Good evening. For those of you who don't know me, my name is Patrick O'Connor. I'm the Chief of General Internal Medicine at Yale. My relationship with the Abt Foundation began in 1986 when I was in search of a home where I could learn the ropes as an addiction medicine physician. Abt became that home for me, and I am forever grateful. This was at a time when the HIV epidemic was exploding in New Haven due to injection drug use, and Abt needed help addressing this crisis. This help came in the form of the Central Medical Unit. Richard Schottenfeld recruited me to join Abt as the medical director of the CMU, and together we worked to build CMU into a unique model of integrating addiction treatment and primary care. Tonight's honorees, Kathleen Carroll and Julia Shee, have both played key roles in CMU and Abt's journey. With the help of Kathy, Julia, and other Yale researchers at Abt, we subsequently demonstrated that primary care-based buprenorphine is indeed highly effective. And as they say, the rest is history. And finally, congratulations to Lynn Madden for her leadership of the Abt Foundation, and congratulations to all of the staff at the Abt Foundation.
Congratulations, Dr. Shee and Dr. Carroll, as you are honored by the Abt Foundation at its 50-year anniversary celebration. When Dr. Kleber began the Abt Foundation 50 years ago, he wanted to assist people with substance use disorder into recovery. He also wanted to use evidence-based practices based on research protocols so they would have appropriate treatment. Dr. Shee and Dr. Carroll have continued the work of Dr. Kleber with their research and their primary care services. I am so proud to say that I worked with both of them. I retired from the Abt Foundation after 30 years in March. I was the Director of Primary Care Services and Nursing, and as such, I worked with Dr. Shee every day for 28 years. I remember when Dr. Shee came to work as a fellow, and I was really impressed with how she really seemed to become a member of the team quite quickly. I was also impressed by her dedication and her knowledge. Dr. Shee treated each person as an individual, and each person she saw had an individualized care plan for them. I was very lucky to work with Dr. Shee. She was a wonderful mentor to me. I could count on Dr. Shee, I could trust Dr. Shee, and I miss her every single day. I was so grateful to have Dr. Carroll work with the CMU team many times with research that Dr. Shee was participating in, and it was lovely to work with her and her team. Always professional, always caring about the patients, and hoping that some kind of new treatment could come along. It was a wonderful 30 years. I am very, very proud to say I was an employee of the Abt Foundation. Again, congratulations to Dr. Shee and to Dr. Carroll, and also happy 50th anniversary, Abt Foundation.
It is my honor and pleasure to say a few words about Dr. Kathleen Carroll. Kathy Carroll is part of the original cohort of addiction researchers at Yale that really paved the way for all of us who subsequently came and are doing research in this department. I remember Kathy from when I was a resident. She and the other addiction researchers were in the little yellow house behind the Connecticut Mental Health Center. Of course, they were not given a place in part of the main center because addiction research at the time was really on the side. Nevertheless, Kathy has had an amazing career. She is known as somebody who has developed some of the integral behavioral treatments for addiction psychiatry, and more recently has translated them to be done virtually. And of course, this is a big part of our field at this time. She has been a mentor to a lot of people, including myself. For some of my earliest clinical trials, she was helpful in helping me analyze the data. This award is well deserved. She is a hard-working person. She's known as a great grant writer and a great colleague. Congratulations, Kathy. This is very well deserved.